Five, six, seven, eight. Anymore. 5, 6, 7, 8. Come on, don't negotiate.
Yeah. Thank you very much, Zoe. So,
I'm Zoe Guinea. I'm an organiser for the New South Wales Nurses and Midwives. We're here today at Lismore Hospital and with Lismore Mental Health to let the community know that their health system is in crisis. We currently have extremely low staffing numbers. We don't have ratios like they do in other states, so Victoria, Queensland, now South Australia is bringing them in. So we don't have ratios, so instead we have a very complicated equation to work out staffing, where ratios is 1 nurse to 4 patients, and in the emergency department 1 nurse to 3 patients. In the maternity wards it's nurses and babies count, so babies are counted in numbers, so it's 1 to 4, but 2 of them are babies and 2 of them are mums. Not like now where mothers, sometimes they have 5 mothers to look after and 5 babies. So that's 10 patients that they have to look after. So we've got a claim before the government looking for safe patient ratios for our patients, for you, the community, and also we're asking for a pay claim, which of 7%. Last year they offered us 0.3% pay rise. That was all we were given, and we are miles behind the other states. For example, Queensland registered nurses level 5 earn about $10,000 a year more than nurses in New South Wales. So we've got quite a lot of issues at the moment. That's why we're out here for safe patient care mainly. Thank you.
My name is Rainer Becker. I'm a nurse in the adult mental health inpatient units in Lismore Base Hospital. Over the past 4 years, what we have seen is an attrition of permanent skilled staff that have left out of various reasons, the biggest reason being safe staffing and safety on the units. So we have episodes where staff call in sick, are unable to be replaced, and staff are forced to work in unsafe conditions because there's insufficient nurses for the acuity on the wards. This has been exacerbated, and currently we are using a high number of agency nursing staff that are replacing actual part-time, full-time employees of the units, which is compromising skill levels, skill mix, and safe working on the wards. And the indications I get is that we have been unable to recruit for various reasons, and that needs to change. And if Mr. Hazard thinks we have the best health system, then I'm sorry, he's sadly mistaken. I see the coalface every single day, and I'm concerned for the safety of my patients and my colleagues.
Shannon Burton, Lismore Mental Health registered nurse. Currently we are facing a lot of pressure. We're expected to look after acutely unwell patients in our service, but we haven't got the resources or the staffing to do that. It's a very dangerous environment. There's commonly assaults on nurses because of unwell patients, because of their symptomatology of their illness, and we're expected to sometimes nurse with under numbers, and we're missing things. We're missing what is actually needed for these patients, and we're seeing more bad outcomes all the time.
Patient ratios. The in charge of shift should not be allocated patients. We want 1 midwife to 3 mothers and their newborn babies. And we want babies counted in the numbers. Absolutely shameful that they're not. We want experienced midwives on duty at all times. And did I say we need the babies to be counted? When we've got non-maternity patients in the maternity services, we need additional nurses there to care for those patients.
Yes.
Yep. Yes. The general wards should be staffed with at least 80 to 85% really senior, qualified, registered nurses.
Yes.
Yes. We want 1 in 3. 1 staff, 3 patients, all shifts in paediatrics. We want 1 staff member to every 3 patients in the emergency department, every single shift. We want 1 staff member to 4 patients in the general wards on mornings and evenings. And the in charge of shift must not have a patient load. So I just cannot believe that there are so many people present here today, because I wasn't actually sure that there was this many nurses left at Lismore Base Hospital. So I'm very, very proud of you all. That's absolutely amazing. So few here? No, there are so many. Well done. So nursing at all levels is an absolutely fabulous career, and we are asking for the state government, Premier Perrottet and Minister Hazzard to keep it that way. Thank you.